And you can see how we can bring that into constant contraction. And we'll go ahead and keep that there. And this is not moving anywhere. You can see how strong that magnet is. But I'd also like to demonstrate for you. So you'll see me turn this on. Look at how strong that pulls up that musculature. You can see that transferring all the way down the spine. If I leave it on a constant pulse mode, look at how much movement we're getting through the entire arm, trap. The unique aspect of this is,
so the beauty of this is you can have a patient who is unwilling or unable to participate physically, and over a course of treatments you're able to actually strengthen and build bulk muscle mass in the glutes, the hamstrings, and abdomen.
Hi, if you're a medical device distributor, a doctor, or even an unlicensed practitioner, you'll definitely want to take just a few minutes and learn about this advanced patented medical device distribution opportunity called ExMI. And the reason that is because it is a $60,000 one-of-a-kind technology. That's the suggested retail price, $40,000 to $60,000, and that's what it sells now. If you buy directly from the manufacturer, presumably as a distributor, you sell it for that as well, or whatever you could get for it. Or you can do an equipment lease. The doctors, practitioners can, for a suggested $6,000 down and $2,500 a month. The buyer or the lessee, if you do a lease, medical equipment lease, earns back the cost in approximately 40 to 60 patients, and for a typical clinic that's only 3 to 4 months. So it's a very fast earn back, assuming $50 to $150 per 20-minute session, or $80 if you're a chiropractor. Now, what we're doing is we're seeking an exclusive distributor licensee in all countries except for USA and Africa. Those are taken. And your cost to acquire these machines, if you do the lease approach, can be as little as $6,500 down. The owner of the company and the manufacturer is Dr. Michael Jordan from Germany. Easy name to remember. He's the sole manufacturer of ExMI technology worldwide. He's been a urologist and prostate surgeon for over 20 years and runs a private practice, some years up to 4,500 patients annually, currently with a urology clinic in Munich, Germany, and the first doctor outside the USA offering ExMI. He used it first as a doctor, and then he acquired the technology because it was so amazing. In fact, he set records first as having the highest success rate for prostate treatments. He's done over 2,000 successful surgeries, but more importantly, he's got the highest, his results are 60 to 80% better than when he uses ExMI with the surgery than without post-op. And as a result, that's helped him to run the most successful urology clinic in Germany, specifically with revenues that are 308% over the median for urological practice in Germany. And he also sold his contract for the highest price ever to date there in Germany. So what is ExMI? It treats nerves, joints, and muscles. It's non-invasive, painless, safe, fast, proven, studied quite a bit, and extremely effective. Over 6 million treatments in 58 countries, no known negative side effects whatsoever. The target market is physiotherapists and sports clubs or teams, chiropractors, neurologists, gynecologists, urologists, proctologists, and general practitioners, as well as putting in assisted living homes or senior care homes where they can make great use of it. It is extremely effective. Improvement is experienced in as little as 6 of those 20-minute sessions, and the maximum outcome is achieved typically within 20 sessions. At the most. The patient satisfaction rate is over 10,000 patients over 17 years in Dr. Jordan's clinic showed a 95% treatment completion rate, meaning nobody stopped going through the process, and the only 5% that did had to do not with the treatment not being effective, but had to do with lack of money or time. They had to leave or move or something like that, or they just weren't available. What it does is it does 18,000 contractions. That's what the magnetic technology causes per treatment, that go as deep as 8 centimeters. That's the world deepest versus the 1.3 centimeters, which is the maximum of all other known technologies that we're aware of. And as a result, Dr. Jordan has seen up to 21 referrals from a single patient because it is so effective. In fact, the healing takes place 3 to 4 times faster than without it, and it's the only solution for some known conditions. Now, pelvic, for example, without ExMI, 1 hour per day, Kegels or gymnastics, as they say, for 6 months, and the patient returns in only about sometimes 6 weeks after that, and they've coming back to the doctor for more treatment. It's not lasting, or as another alternative, without the ExMI, you can twice daily for 6 months use a anal or vaginal electrical probe, and that only gets 1.2 centimeters deep, and it's very uncomfortable. People hate doing it. Many patients refuse, but with ExMI, you don't do either one of those. And 55% of patients treated in Dr. Jordan's practice are still satisfied with the outcome, even after a year, assuming that they did 20 sessions. They still have the healing effect. So it also treats nerve and joint. There was a patient that Dr. Jordan had who had no mobility in one of her arms after a stroke. And after 10 shoulder and 10 forearm treatments, she had a significant restored mobility, which is just amazing after 7 years of really no mobility. And in one case, there was a severed arm that was reattached and achieved full mobility restoration after 6 months. Dr. Clark in Anchorage, Alaska, who did the surgery, called it an amazing recovery, saying that all function was restored, the neuromuscular function. Here, I've actually got a video clip. Go ahead and listen to Dr. Clark really briefly talk about the amazing recovery himself.
Associates whose wife had a severed arm from an accident with a saw, who ended up being in a cast, doing daily treatments with the chair, and had amazing recovery with all function back, neuro and muscular, within 6 months.
So overall, Dr. Clark, as far as the chair being used in incontinence and other modalities, any feedback there from your patients or from yourself?
Very good. We use it for post-prostatectomy recovery, both erectile function and in our penile rehabilitation program, and the avoiding function is markedly improved. We have a female urogynecologist who uses it for her female stress incontinence, for her post surgery patients as well, for rehab. So I think across the board.
How long have you been using the chair?
Oh, probably 5 years.
5 years. Okay.
Okay, so you heard in the video there, he also uses it for many other things for years, but he also said that it was treating her arm through the cast, and you could see here that's one of the advantages of the, and this is under the U.S. distributor. They market and sell it under React Innovations brand, so you can white label as a distributor how you like in your country. But you can see here what they've done is compared it to the other technologies that are available. No direct skin contact, muscle penetration depth, 7.5, really 8 centimeters, but can treat through cast or uniform. So that's really key. 30-second startup time, no attendance required. It's just so easy and instant to do, and it's been highly studied and published. If you go on the National Institutes of Health website, their PubMed, you can cite a number of those studies. There's about 150 published papers that are out there. Many of, like I said, some of those are up there on the National Institutes of Health pub site. Okay, so what does the ExMI treat? From a clinical standpoint, vaginal tightening about as little as 3 weeks after delivering a baby. So a gynecologist, urology practice, general practitioner can do that. Incontinence, extremely effective for urologists. It treats urge incontinence, which is like the overactive bladder, stress incontinence up to 3rd degree with no prolapse, and incontinence after a radical prostatectomy and removing the prostate with the cancer. So or erectile dysfunction, it's very effective against, an alternative to drugs like Viagra and so forth, which don't treat the root cause. Great for a general practitioner or urologist. Orgasm problems, men and women, and pelvic pain. Again, a GP and a uro treat that. The chronic prostatitis, the bacteria, it's the only known effective treatment in Dr. Jordan's experience for that. And hemorrhoids, it's healed hemorrhoids for his patients in 1 to 2 days, which is quite amazing. So GPs and proctos can benefit from that, and fibromyalgia for with the general practitioners, it treats that as well quite effectively. And really difficult to reach muscle groups like the rotator cuff, the hip flexor, the sciatic, the buttocks, the chest, the groin and abs, and the back and spine interior muscle. Now, this is a picture of a lady who's receiving a treatment as we speak, sitting there. Again, you don't need, there's no invasive, clothes on, cast on, baby in the lap, whatever. 20 minutes, you're in and out. No pain, no discomfort, no side effects, extremely effective. And again, treating through the clothes. The first is the chair, this is the wand, as you saw in the original video. And what are the threats and risks to a distributor if they decide to take this on and start distributing? Well, it was patented in 1994 and FDA approved in 98, 2 FDA approvals actually. In 20 years, it hasn't had any real competitors because it's so difficult to replicate or reverse. Many have tried, but they've all failed, and that's due to the expensive high-tech machinery and molds required to make the advanced magnets that are in there, and the very advanced power supplies. Both of those, nobody's been able to do. There's really only 7 pelvic competitors right now that compete with the chair in Turkey, Japan, Slovenia, Liechtenstein, Russia, and Korea, and they're not really effective. They use a simple air core versus an iron core magnet because they couldn't do that. They don't have the money and the machinery to make the very high-tech magnet, and so it's really a disservice to their patients. They're using the studies. They're using all the studies that have been done on the ExMI and claiming those studies apply to their chair, which is a complete false statement. And there's only one competitor that's really focused on the physio, which is what the wand does, and that's somebody in Korea, again using that same air core magnet and not being honest with their patients. Your opportunity as a distributor, we're looking to license exclusively 1 per country. If you're a doctor or an unlicensed practitioner and you happen to be listening to this, we can sell or lease to you direct, so you don't have to wait until a distributor gets set up in your country. You can buy it for $60,000, lease it for $5,000 down, plus $1,500 a month. Just give us a call or email us. There should be some information right around or underneath the video here, and we'll be happy to answer any questions that you have and get you the next distributorship license or equipment purchase if you're a doctor or unlicensed practitioner in the states where you're able, or in the countries where you're able to do that. Some you can, some you can't. Check with us and we'll let you know. Thanks for listening.